Hello students, a very good morning to all of you. Today we are going to see nerves of the upper limb. What are the nerves supplying the entire upper limb? Today we are going to see. Before starting that individual nerves, first we have to revise the brachial plexus. As you people know that this brachial plexus is supplying the upper limb muscles. Okay. Now we'll revise the brachial plexus briefly. Here, the brachial plexus is formed by, these are the ventral rami. Ventral rami of lower cervical, lower forecervical, and a greater part of the anterior primary rami of the thoracic, of the first spinal thoracic nerves. Okay, sometimes a twig is also coming from C4, which is attached to the C5. In such cases, T1 is not giving flexes, it is not giving branches, so the flexus is shifting towards one step upward, that is C4. That such kind of flexes are called brachial flexes. Sometimes C5 is not taking part and it is shifting towards T2, another step from C6 to T2, then it is called as post-fixed brachial flexus. That thing you people know. Again, now we will see how the formation of brachial plexus takes place. The mode of formation. Here there are 5 stages in the formation of brachial plexus. One is the root, trunk, and then divisions, cards, and the fifth one is the branches. So the plexus is divided into 5 stages. Okay, in that first one is root stage, trunk stage, division stage, cord stage, and branch stage. Okay, now we'll see the roots. Okay, so all ventral rami of spinal nerves, roots of C5, C6, C7, C8, and T1 forms the brachial plexus. Okay, so what are the roots? C5, C6, C7, C8, and T1. All these are the ventral rami of all these roots. And next stage is the trunk stage. How these trunks are formed? The ventral rami of C5 and C6 forms the upper trunk. C7 alone forms the middle trunk. C8 and T1 unite to form the lower trunk. This is the second stage where the trunks are formed. After forming trunk, next stage is the division. Each trunk is divided into anterior division, that is light blue in color, and the posterior division, that is thick blue in color here in this pic. Yes, this one. So this is the anterior division of upper trunk, and this one is the posterior division. Again, in the middle trunk, this is the anterior division, this one is the posterior division. In the lower trunk, again it is this one is posterior and this one is anterior division. So each trunk is divided into anterior and posterior divisions. We can call it as ventral and dorsal. So both terms we can use it simultaneously. Don't get confused. So again, next stage is the cord stage. Cords. So these cords are finally going to give branches. Okay. Next one is the cord stage. Here each all the posterior divisions you can see here, all the posterior divisions, all these 3 posterior divisions of all the trunks సో పోస్టీరియర్ డివిజన్స్ అన్నీ ఫ్యూజ్ అయ్యాయి కాబట్టి ఆల్ దీస్ పోస్టీరియర్ డివిజన్స్ ఫార్మ్స్ ద పోస్టీరియర్ ట్రంక్. ఓకే, నెక్స్ట్ the anterior division of upper trunk, anterior division of upper trunk, anterior division of middle trunk forms the lateral, forms the lateral, and only the medial cord, the medial cord is formed by only the anterior division of lower trunk, only anterior division of lower trunk forms the medial one, medial cord. Okay, so this, all these things you people know, I have explained in the classroom again. Okay, now you will get the clarity. Okay, so lateral cord is formed by the anterior divisions of upper and middle trunk form the lateral cord, and only the anterior division of the lower trunk forms the medial cord, and all the posterior divisions of upper, middle and lower trunks forms the posterior cord. Now we'll see the branches. So the branches which are coming from these cords are called as main branches, and also some of the branches are coming from root stage and as well as the trunk stage. So what are the nerves coming from the root? So there are two nerves which are coming from the C5 root. So one nerve is the nerve to rhomboidus. First nerve is the nerve to rhomboidus. C5 is giving one branch that is called nerve to rhomboidus. It is also called as dorsal scapular nerve. And also another nerve which is coming from the C5 root itself is the phrenic nerve. So phrenic nerve is also coming from this C5. This phrenic nerve supplies the diaphragm muscle. Okay, if any damage at root C5, the people may have some respiratory problems. Okay, this is phrenic nerve, and this one is dorsal scapular nerve or nerve to rhomboidus. And also some nerves which are coming from roots of C5. So one nerve is present from which is coming from the roots C5, C6 and C7. So all these three unite to form one nerve called as long thoracic nerve of Bell. This is also called as nerve to serratus anterior. So C5, C6, C7 gives a nerve called nerve to serratus anterior, and it is also called as long thoracic nerve of Bell. Okay, these are the roots which are giving branches and which are supplying to the specific muscles. The first one, C5, is giving two nerves. One is nerve to rhomboidus, that is dorsal scapular nerve from C5, and phrenic nerve which is supplying to the diaphragm muscle, that is also coming from C5 root. And there are some other branches which are coming from the root level or the C5, C6, C7. All these three unite to form to give a branch called long thoracic nerve of Bell. It is also called as nerve to serratus anterior. And also all these roots also giving nerve supply individually like this: C5, C6, C7, C8 and T1. All these are supplying to scalene muscles and longus colli muscles. These are the muscles present in the neck. What are those muscles? Scalene muscles and longus colli muscles. So each nerve root is giving an individual branches to supply scalene muscles and longus colli muscles, which are the muscles present around the neck. Okay, so this is an additional point, you can note it. Next comes to the root trunk level. What are the nerves present, branches which are coming from the trunk? Okay, so in the trunk, so the C5 and C6 roots, that is the upper trunk, gives the nerves. One is the nerve to subclavius and suprascapular nerve. So one is the suprascapular nerve and another one is the sub nerve to subclavius. Another one is the nerve to subclavius. So again, so this upper trunk gives two branches. One is nerve to subclavius, nerve to subclavius. Another one is suprascapular nerve. So nerve to subclavius is from the front of the upper trunk, front of the upper trunk, front of the upper trunk. But as the suprascapular nerve is from the outer part of the upper trunk. Suprascapular nerve is coming from the outer part of the upper trunk. And also the point of origin of the branches from the upper trunk is called as Eppes point. This point is called Eppes point. So at the Eppes point, sorry, not this one. So this is called the Eppes point, where all the branches are coming from. Okay, 6 branches are meeting. 6 branches are meeting. That point is called Eppes point. I have explained in it. So you can make this point as Eppes point here. So all the nerves, so these two divisions and also these two branches and these two divisions, all these unite at a one point, that is called as Eppes point. Okay, so upper trunk only gives branches and the remaining trunks form divisions and the cords. Now coming to the lateral cord, the branches which are coming from the lateral cord are lateral pectoral nerve. Lateral pectoral nerve is coming here, lateral pectoral nerve, and then the musculocutaneous nerve, and then the musculocutaneous nerve. Lateral pectoral nerve and musculocutaneous nerve, and also lateral root of median nerve. Lateral root of median nerve. These are the 3 branches coming from the lateral cord. Simply we can call it as LML. Okay, LML, lateral pectoral nerve, musculocutaneous nerve, and lateral root of median nerve. Lateral root of median nerve. This is the LML. Next, coming to the medial cord. This is the medial cord. This medial cord. So the important nerve in the medial cord is the ulnar nerve, and also so here they have already mentioned this is the ulnar nerve. Now what are the other branches which are coming from this thing is, so one is the medial root of median nerve. This is the medial root of median nerve, and this one is the ulnar nerve, and it is also giving 3 branches, other 3 branches. One is the medial pectoral nerve. So in the lateral cord we have seen lateral pectoral nerve, and here we are going to see medial pectoral nerve. Okay, and below that one, medial cutaneous nerve of arm, medial cutaneous nerve of arm, and also medial cutaneous nerve of forearm. So normal mnemonic is 4MU. One is the 1M is the medial pectoral nerve, and next one is the medial cutaneous nerve of arm, and next one is the medial cutaneous nerve of forearm, and medial root of median nerve. This is 4M, and last one is the U, that is the ulnar nerve. These are the branches of this medial cord. Next, the last one, that is the posterior cord, is giving 5 branches. This is also giving 5 branches. Already here they mentioned this as the radial nerve. This is the radial nerve. Here I have shown this extension of this radial nerve. This is the radial nerve. So for this also it is having a mnemonic, but don't get confused with the ulnar nerve. So the mnemonic is also ulnar here, ULNAR. So for only mnemonic you should take in the posterior cord, not the nerve. So one is the upper subscapular nerve, ulnar upper subscapular nerve. Next one is the lower subscapular nerve. Next one is the lower subscapular nerve. Next, in nerve to latissimus dorsi. So nerve to latissimus dorsi is present in between the upper and lower subscapular nerves. Okay, and next one is the axillary nerve. Okay, so next one is NA. This one is axillary nerve. So actually axillary nerve is present, comes anteriorly, so the nerve is present here at this side. So this is present in this side. Okay, so these are the branches of posterior cord. One is the upper subscapular nerve, lower subscapular nerve, in between nerve to latissimus dorsi, and then the axillary nerve and the radial nerve. Okay, these are the branches of main branches of brachial plexus. Okay, now we will see individual nerve supply to the upper limb in the next video.